The pain was horrible, like a constant 8, 9, 10 on the scale level.
I had epidural injections and I was taking the daily medicine.
I would have a lot of trouble sitting down for long periods of time.
It started to affect my mood. I was really depressed.
Constantly dealing with it for 20 years now. I needed to do something different this time.
I was tired of the pain. I needed a new way to deal with it.
We have developed the Back on Track program to help low back pain patients manage their pain themselves from a non-surgical, minimizing medicine perspective. The patient's beginning to understand the relationship of their pain, and they start working through the process.
TREC stands for the 4 cornerstones of the program: transform, restore, empower, and knowledge. We want to transform their lives, bring back quality of life. We want to restore their function. We want to empower them to take control of their pain as opposed to the pain controlling them. And we want to provide them the knowledge to be able to accomplish all of those things. Patients are referred to me from either a physician or physical therapy. Some patients are self-referred.
We evaluate patients and help them without jumping to injections, pain pills, and surgery. We have found that patients have gotten significantly better with the physical therapist who specializes in chronic pain, as well as our pain psychologist or behavioral medicine specialist.
The behavioral aspect of it in combination with the physical therapy is what completely made this a success.
Patients need to realize that this is a 12-week commitment.
They were really flexible. There were so many appointments available.
In the 12 weeks that you're here, you can figure out ways to live and really live on your own.
Sometimes people have such fear of being active. What we're doing is providing the tools for how to decrease the fear and how to actually live their life the way they want.
My role with the patients is to improve their function, reduce their pain, work on achieving goals, and we do that through exercise. But in Back on Track, it's a little bit different from traditional physical therapy, educating the patients about what pain is. That first week, people are hesitant. It's kind of amazing when you develop this trusting relationship with the patient to see that they feel some relief. They feel like they're going to be taken care of.
It's not the same kind of therapy that I did a million times. They don't necessarily concentrate on my back. We're just trying to make me a stronger person.
Every patient that comes into the program sees a psychologist initially for an evaluation. Each patient is required to attend a weekly group session. And then for individuals that are struggling more, I do meet with them individually. There is such a common feeling of being isolated and alone and misunderstood. So when they're sitting in a room with individuals that do know what it feels like, that helps to normalize their experience and form a connection with somebody.
What's nice about it is there's people in there from all different stages of their program. You see how other people deal with the pain.
You get an education about pain and how your brain works with it.
Another really important component is relaxation training and meditation. We want to help folks with chronic pain learn how to decrease the activity in their central nervous system.
Having people positive around you, helping you set realistic goals for yourself was good.
The team approach is vital to treat a complex condition like chronic pain.
We meet weekly to discuss how patients are improving.
It's so valuable to have that extra insight.
Cleveland Clinic is at the forefront of many things. That includes dealing with this chronic pain epidemic.
What I love about this opportunity is that we're really transforming care.
And we're definitely there to support the patients.
You're going to look at them as more than your health care people. They do become your family.
You really have nothing to lose coming to this program. You can only gain from it.
I don't rely on daily medication.
If I weren't in this program, I'd probably still be laying in bed.
Tools to control your pain, and it really helps.
It is an absolute life changer.
Now I feel like I have a little bit more power to say, you know what, this is my life, I'm taking it back.